status and its impact on breast cancer. Just a few housekeeping guide. Everyone is encouraged to have their devices on mute, except if they have to speak. We will be taking questions at the end of the presentation, so feel free to write down your questions. The chat box will be on the bottom of our screens, while to the bottom right-hand corner will be the queue for raising our hands if we have questions. Just for starters, and as a warm-up, we're going to have a music dance session. So Wendome, whenever you're ready, you can play our music. Okay, thank you so much, Wendome. Thank you for that video. I see we have a few more people. Miss Terry, thank you for joining us.
You're
All
welcome.
right, so we're going to go right next to the main topic of the day. Our first presenter is Dr. Adiola Akindana, a diabetes nurse practitioner and certified diabetes care and education specialist. For over 15 years, Dr. Akindana has dedicated her career to diabetes care in various capacities, including diabetes research, inpatient management, outpatient education, and in capacity building in developing countries and in educating the communities. Ladies and gentlemen, please join me in welcoming Dr. Adiola Akindana.
Good morning.
And people mute their phones. Okay, go ahead.
I don't have the slides.
Oh, woman?
Yes.
Start with slide. Oh, okay. Well, I guess start with slide 1. Good morning again to everyone, and thank you for taking time out of your Saturday morning to join us and also to get educated. Let me see how I get this thing is kind of in my way. I can't see the whole full slide. Oh. Hold on a minute. I don't want to press the wrong thing. I probably did press the wrong thing. All right, so here we go. That's better. Yeah, as said earlier, please mute your phones. If you have any questions, you could either type it into the chat box below, or you could write it down on a piece of paper, and at the end we have plenty of time for Q&As. I hope people got to warm up a little bit. I did anyway, get the blood flowing. So today we're going to just address a little bit more about diabetes, the ABCs and diabetes. And this is October, which is Breast Cancer Awareness Month, and tied really into breast cancer and, you know, sorry, I'm being distracted here. So next slide, please. Oh, go back a minute. I am so sorry. All right. So what is diabetes? Let's start with that question. Diabetes is the inability of the body to use insulin that it makes properly, and to use the food we eat for energy. So what does that mean? Our body makes insulin naturally from the pancreas, and that is what is a key that helps us move the food that we eat into our cells, and our cells is using it for energy. When you have diabetes, this is no longer working properly, and what ends up happening is that the blood sugar continues to go higher and higher and higher because the body does not have enough insulin, either because there's insulin resistance or the body doesn't make enough insulin that it needs. So next slide, please. So there are different types of diabetes, many more than is written here, but the 3 main types of diabetes is type 1 diabetes, which is an autoimmune disease where the body does not make insulin at all. And for this kind of people or patients, they would require taking insulin for the rest of their life to survive. So our body actually requires insulin for us to be able to use the nutrients we eat as an energy source. And then you have type 2 diabetes, which 90 to 95% of all people diagnosed with diabetes has type 2 diabetes. This usually occurs either because there's family history of diabetes, because the person is overweight, It's preventable. You can also delay having type 2 diabetes. It happens more in people of color, so African Americans, Latino, Hispanics, Asian Pacific. People are more likely to get type 2 diabetes than non-Hispanic whites. In type 2 diabetes, what we see often is insulin resistance. And what do we mean by that? That means your body is making insulin, but it's really not using it. So it continues to task your pancreas, which is what produces the insulin. And then eventually the pancreas gets tired and it makes less and less and less insulin. And this is when the diagnosis of type 2 diabetes comes into the picture. The third main type of diabetes is also gestational diabetes. And this is for pregnant women who, because of the pregnancy needs and the needs of the baby, become more and more insulin resistant. And so they develop diabetes during pregnancy. It is very important for women, if they are diagnosed with gestational diabetes, to follow up with their provider after they have the baby, because it's a very telltale sign and first indicator that that person, that woman, is at risk of developing diabetes later in life. Lastly on the list is pre-diabetes, and so many people live 10, 15 years in pre-diabetes and it's never picked up. Nobody really knows. This we see in people who are overweight, who don't exercise, who don't eat healthy, and over time.
That's a get it.
All right, mute your phones, please. So, and then over time, the body again continues to work the pancreas so hard, and after a while, it doesn't make enough insulin. And by the time the person is diagnosed with full diabetes, many, many years would have passed. The good news with pre-diabetes is that you could turn back the clock of time. You can either delay having diabetes type 2 or even prevent it from happening. And I believe we're going to talk a little bit more about that as we go on. Next slide, please. Okay. So what's the hula hoop? Why are we making so much big fuss about what diabetes is and what can happen? It's because of the end point, and we call it organ diseases that can happen as a consequence of uncontrolled diabetes, the complications. And I kind of wrote it in order from head to toe of what can happen. So first is stroke can happen in the brain. And of course, we all know when people have stroke, if they are lucky, they don't have significant physical deficits, but oftentimes they might end up not being able to walk, be paralyzed on one part of their body, not being able to talk. Sometimes it even leads to death. And then the bleeding cause of blindness as well. So when you have diabetes, it's important that your blood sugar is very well controlled. It's also important that you see the doctor regularly to make sure that you don't have diabetes or high glucose affecting the blood vessels in your eyes. It can also affect heart disease. And one of the precursors to that is high blood pressure, high cholesterol. They all kind of work together. People who have diabetes tend to have high cholesterol, tend to have high blood pressure. So it is very important that you have your blood pressure under control. It's also important that you have your cholesterol under good control. We'll talk about some of the ways we could do that as we go on. It can also lead to kidney disease and eventually kidney failure. So kidney disease really is when the kidney is just not filtering the blood very well. And When it doesn't filter the blood very well, you have glucose that, I mean, I'll use the word sugar to make it easier for us to understand. So you have sugar that is in your body, and it's just destroying everything as we go along, and including the kidneys. Eventually, if care is not taken, it can lead to kidney failure. And at that point, the kidneys is not able to filter the blood, and the person can develop toxicity, which can lead to death. So to prevent that, they end up on dialysis, and that's really for the rest of their life unless they get a kidney donation. So we want to keep our own kidneys, because there's also the risk of rejection even when one gets an organ donation. So it's better we keep ours. Another issue, like I said, I'm going up from top to bottom, is affecting reproductive organs. For women, they are more likely to have itching, to have UTI, urinary tract infection, dryness, where they are not able to enjoy having intimacy. And for men, it can also lead to erectile dysfunction, where they're not able to perform, for lack of a better word. So again, these are things that are reversible, that can be slowed down if caught quickly, and controlling blood glucose, controlling that blood pressure, as we said, and controlling the cholesterol level. Those three things are really very critical. Nerve damage is also another complications of diabetes, uncontrolled diabetes, I should say. And when there's nerve damage, the patient or the person might feel tingling, burning sensation, and after a while, numbness, where if they hit their foot on something, or if they carry something hard with their fingers, they don't even feel the pain. Or if they step on a nail, they might not even know, or glass or whatever, that they stepped on anything, because the nerves is what sends message to our brain, especially the pain signal. So we need that pain signal, very important.
Oh my God.
Welcome everyone. Please, as you're coming in, remember to mute your phone so that we don't pick up whatever is going on in the background. And because of this nerve damage, it increases the risk of when there's injury, poor healing. And when there's poor healing, it could lead to gangrene on the foot, especially, and where they have to amputate. Sometimes it starts with a toe, and then it starts with the foot, and then it starts with the leg. They might do a below the knee amputation, and even sometimes above the knee amputation. It just depends on how bad it is. And this again is avoidable. Uncontrolled diabetes is the leading cause of loss of limb, one having an amputation. And ultimately, it can lead to the demise of the person, where they end up just dying, either from, a lot of multiple of these complications, or stroke, or massive heart attack, or from an infection where they become septic. So it's just a lot of bad things that ends up happening from there. So we want to make sure, if you don't have diabetes, to at least delay, and even prevent developing the disease. And if you do have it, be very sure to control it, checking your blood sugar regularly, eating healthy, exercising, following up with your doctors, and we'll go over more of those things in the next slide. So what can I do? So what can I do? What can you do? What can all of us do to stay healthy? Next slide, please. It is critical that you know your ABCs. A is for A1C. What does A1C do? A1C, I always say, is like a report card. So every 3 months, you go to your doctor and they draw blood, or they send you to the lab to go get your blood drawn, and then they get the results back. So if you've been diagnosed with diabetes, the goal is for your A1C to be below 7%. That is the target. Now, as we get older, especially people above 70s or in their 80s, or if the person is prone to having low blood sugars, we call hypoglycemia, the doctor may want that number to be a little bit above 7, but definitely not going into 9s and definitely not going into 10s. So this is important that when your doctor gives you that paper, you get your blood work done. Next is B is for blood pressure. Now there, in our diabetes world,
Mr.
Bezo, please mute your phone. Thank you. Welcome. So in the diabetes world, we want the blood pressure to be below 130/80. However, you need to talk to your doctor, because as we get older, or depending on if there's other health conditions, the doctor might want to tailor or individualize what that blood pressure should be. But the lower the better. Normal blood pressure is less than 120/80. Both numbers are important. The top number, when we say 120 or 130, 150, is called the systolic blood pressure. And that's when your heart is pumping blood into the rest of your body. And the lower number, when we say 80 or 90 or 110, God forbid 110, because we definitely want it below 80, but that's danger, clearly, is when the heart is resting and receiving back the blood. So both numbers are very important. One cannot be good and the other one bad. So we have to make sure that both numbers are within goal. If you are on blood pressure medication, it's important that you get a blood pressure monitor and you check your blood pressure from time to time. You write it on a paper. If you want the right way of checking your blood pressure, you sit quietly for 5 minutes with your foot to the ground, and then you check it and you write it down. And you want to ask your doctor, what is my target? What am I working towards? So that when you are checking your blood pressure, you know, am I at goal? And if not, then I need to call my doctor and let them know. And the C is cholesterol. We don't want high cholesterol, avoiding fried foods. Again, this is a blood test. And I should just digress for a quick minute. All these tests that we go and we get blood drawn, oftentimes your doctor orders the blood draw after your visit, and then you don't see them for 3 months. By the time you go back, that's already old news. So whenever you get your blood drawn, it's important you call your doctor's office back and have them go over your lab results with you. Better yet, what I do, I make sure I have my lab slip and I go 1 to 2 weeks before my appointment, so that when I get to my doctor's appointment, we already have that information and we could go over it at the same time. So that's just a suggestion for you. Next slide, please. So diet is what we eat matters. There's nothing, I don't know what else to tell us. Well, we need to have a healthy plate. And there's My Plate. If you Google that, My Plate, it will show you what a plate looks like. Half of your plate needs to be vegetables, and only a quarter of our plate should be starch. Now, if we want to eat our fufu, because we are mostly Africans on this session today, we have different things that we call fufu. You need to, I always just advise about the size of your feast is the portion you should be eating, and eat more of the vegetables with it. And we have fufu that is amala. We have fufu that is eba. We have fufu that's plantain. We have wheat flour. Try different ones. Check your blood sugar when you eat it and see which one your body can tolerate. So you will find that when you eat one, and it varies for everybody, that your blood sugar might be very high afterwards, versus if you eat maybe the wheat flour or whatever, oatmeal flour or whatever you ate, that it doesn't make your blood sugar go too high. So it's very important you test your blood sugar and see what the results are. Eye exams are important. Is the again, uncontrolled diabetes is the leading cause of blindness in people. There is no way you can know, even when you're losing your vision, you don't really realize it, and we often think it's related to old age. But the doctor needs to put a drop in your eye and look in the back of the eye to make sure there is no diabetes disease in your eye, so you don't lose your sight. Foot exams, nobody on this call should be walking around barefoot. Always have some kind of slippers on in the house. Covered toe shoes is better. Or if you're gonna wear open toe, make sure it's the one that kind of has protection at the front, that your toes is not really at the edge of your slippers. So if you hit your foot, you don't actually, if you hit your shoes, I should say, you don't actually hit your toes. Make sure you also check your foot daily when you take a shower.
Is it
I've
what?
had patients who say, I never check my foot. And I'm like, well, you have to grease your feet, right? So just 1 minute as you after your shower, just check when you're greasing your body, make sure there's nothing there, there's no color discoloration, there's no foreign object in your foot. Make sure you keep your annual appointment with the podiatrist, which is a foot doctor. And when you go to your primary doctor or your endocrinologist, whoever is following you, once you get in there, don't wear pantyhose, because then you can't take it off. Wear socks and take it off. I don't care if your foot is stinky, that's their problem. They're getting paid. And if they don't check your feet, say, doctor, you need to check my feet, because that's part of their responsibility towards you. Next slide, please. So glucose monitoring, I call that the test. So where A1C is your report card every quarter, every 3 months, glucose testing, which is pricking your finger and getting a number, is your daily test of knowing where I am, what I ate last night. If I wake up this morning and I check my blood sugar, what's that number, you know? And ideally, we want your fasting blood glucose or before a meal blood sugar to be between 90 and 130, all right? So that's the ideal. You could go as low as 80. Once you start getting into 70, it's like your car running out of gas. You need to eat something. All right. And you can also just talk to your doctor about what is your goals. So very important, a lot of what we are discussing today, take a few minutes, ask questions to your doctor. I'm doing all these things you want me to do. What are you expecting? What's the result you're expecting? So that when you're doing those things at home, you know if you're on target or if you're not on target. Healthy living, that's also very, very important. How do you live your life? Importance of modest weight loss. So if we are overweight, this is where the bang for the buck for people who have pre-diabetes or even not been diagnosed yet with diabetes, because it's one of the leading causes of developing type 2 diabetes is being overweight. And we're not saying you need to be model slim. So just about 10% of your weight would reduce your risk of developing diabetes or even help you with better control of the disease. So if, say, for example, you're 200 pounds, just even losing 20 pounds pays a lot of dividends. Smoking cessation. So I'm sure many of us do not smoke, but if you do or if your family member does, again, is a leading a risk for complications. It's important to stop smoking, moderate drinking. So no more than 1 drink a day for women and no more than 2 drinks a day for men. And have an action plan. If you don't have if you say, oh, I want to start exercising, and you don't even have the sneakers to go, or you don't have what type of exercise you want to do, then you really don't have a plan. You're just talking about it. So have an action plan. I need to buy new sneakers. Then go to the store, buy new sneakers. I want to have a walking partner, for example. Find a neighbor or friend or whomever that you guys can keep each other motivated. I have a friend of mine that lives around the corner. Even 8 o'clock, we still go sometimes. We're like, nope, we're not giving it up. We're still gonna go. So we hold each other accountable. immunization. So, of course, with COVID out there, it has really heightened immunization and vaccination about so many, diseases that can kind of create havoc or problems. We do have immunization for flu. And some people sometimes say, I don't want to take the flu shot. I never get the flu. The thing is, when you're older, or if you have a chronic problem like diabetes or cancer or high blood pressure or all those things, it may not necessarily stop you from having the flu, but it will give you a good chance so that the flu does not kill you. About 30 to 60,000 people die every year in this country from flu. So it is a serious problem. And for people also with diabetes, at least once in 5 years, you get the pneumonia vaccine. So I already went and got my flu shot for this year. So once a year you get the flu shot, and every 5 years you get the pneumonia shot until I think you're over age 65. And there is the controversy about the COVID vaccine. And all I would say is follow the science on that. Next slide. Okay, so again, like I said, stay right where you are right now. Thank you. So those are really some of the basic things that are very, very essential, that if we follow these ABCs that we talked about, you could live a healthy life with diabetes. Full disclosure, I tell people all the time, I also have diabetes. I've been living with it for 21 years. And I actually was like, whoo, for my 21st birthday of having diabetes and no complications. It's no small feat to not have complications. And it really doesn't take a lot. It's just about routine, learning your body and listening to your body, listening to your doctors, and doing what we need to do on a regular basis to stay healthy. So before we get to the next part, we're going to pause for a minute, because both for any chronic disease, including diabetes, stress is a big, big factor. So we need to, when we started this morning, we started with the cardio, with that Zumba dance to get the blood pumping. But we also need to know sometimes that we need to find ways to distress and help our body to be calm. So we have Ifia Ranger, and I guess the moderator will do better introduction, but that she will be taking us through the yoga, and I'll pass it to the moderator.
Thank you so much, Dr. Akindana. That was a very informative session. Thank you. So yes, you are right. So while we do all of these good things, we also have to match it up with some form of exercise. And exercise really doesn't have to be strenuous. You know, we had the cardiac workout that we did, which is very easy. You can do it in the comfort of your own home. Just have some nice music on and just dance, whichever way it pleases you. It helps pump blood around your body. It helps your heart function better. And then there's another form that you can also do, which is stretches and relaxation, which also works in meditation. It works on your mind. It helps you calm down, and it also helps stretch your muscles. A lot of us do not even know that stretches are really, really helpful. We think exercise is just you jumping on the treadmill. No, sometimes you really have to do the stretches and meditation, which is really, really therapeutic. So with that being said, I'd like to introduce Ifia Ranger. Ifia started her journey of yoga back in 2008 and received her 200-hour right in 2014 at Loyola Marymount University in yoga and healing science. She also teaches. She's a trainer. She's experienced with the five most popular styles of Hatha yoga currently practiced, and her favorite is the Vinyasa. Her classes incorporate other important elements, including meditation, pranayama, which is the breathing, the yoga anatomy, inversions, and more. Her yoga classes provide self-care to help create and increase empathy, build resilience, increase self-reflection, decrease stress, and prevent prime of life burnout. Ladies and gentlemen, please relax as we enjoy this yoga session from Ms. Ifia. Over to you, Ifia.
Okay, good morning. My name is Ifia, like she said. I'm trying to show my video, but it says the co-host has stopped it. Do you mind allowing me to show my camera, please? Okay.
Coming back. Okay.
There we go. Okay, hello. So I just want to ask a few questions to everyone. Has anyone experienced yoga before? Yes, okay. And how did it make you feel afterwards? Good, awesome. Do you guys know about the benefits of yoga and what it can bring to your well-being? Well, just think about it for a few minutes. So she mentioned releasing stress, strengthening the body, and also controlling the mind. So yoga is very good for improving mobility and function, reducing stress again, improving your mood, also increasing psychological well-being. I read a study about the quality of life is also important for breast cancer patients. It said that the early initiation of yoga has a support treatment in cancer and positive impact on quality of life. So teaching yoga allowed patients to practice yoga by themselves and also enhance the quality and physical ability of their lifestyle. So what I'm going to work you through today is chair yoga. So you guys can just have a regular chair like this. So it's suitable for absolutely everybody. It's a wonderful way to get into yoga if you have limited range of motion for any reason, okay? Even if it's because you're dealing with the injury for a while, like a knee injury, chair yoga is good for the knee injury as well as many other things, okay? So take a seat on the edge of the chair. Place your hands on your knees. You're at the edge of the chair. Just relax your shoulders down. Sit up nice and straight. You're going to take a nice deep breath in through your nose and out through your mouth. In through your nose and out through your mouth. Lift the crown of your head up. You can close your eyes as you're breathing. It's a nice deep cleansing breath in through your nose and out through your mouth again. Being really mindful of your posture throughout this practice. And we'll be moving very slow, so there's no need to rush. This is meant to be for everybody, regardless of age or experience level. Continue to breathe, filling your whole chest with the breath, slow and steady. And we'll continue with this breath, but now let's add in a little neck circles. So just drop your head over towards your right shoulder, and then trace little half moons as you drop the chin to the chest. And then inhale to lift back up, so just half moon, so you're not taking the head all the way back. And then back to the right side. And relax your jaw fully so that there's no tension. Just half moon neck circles. And the next time you bring your right ear to your right shoulder, just hold it there. Then you can extend your left arm out to the side to deepen the intensity of that stretch. You're welcome to bring you're welcome to bring your right hand to the top of your head to deepen that stretch. And if it's too much, you can let go of the arms. Not looking for anything too intense, but it's a great way to release tension in the shoulders as we're always in front of our computer now since COVID. I don't know if you're from home, but I am. So this is good to release the shoulders and the stress and tension there. And then release here. Drop the left ear to the left shoulder. Once again, maybe using the left hand to pull gently Keep your spine lifted, so it's long, no slouching. Being mindful of our posture. And then exhale, come back to center. So imagine to hold on to the front of your knees as we do cat and cow in our chair. So as we inhale, we're gonna lift and pull our knees and round our chest towards the front of the screen here. And then exhale, press your back towards the chair, but not on the chair. Inhale, bring your chest forward, open your heart. Exhale, rounding, contracting. This pose is called cat-cow. Inhale, press the chest forward, and then exhale back to neutral. Now we bring our left hand, and we bring our right hand to the back of our chair. And we do a mini twist here. If this is too intense, you can bring your right hand back down and just twist gently.
Yes.
And then exhale, release. Now bring your right hand to the left side of your body. Lift your left hand to the behind of your chair. Inhale, lifting and lengthening your spine, looking over your left shoulder. If this is too intense, you can bring that left hand back down to your side. And just gently look over your left shoulder. No slouching here, no rounding forward here. Be mindful of our posture. Grounding our feet into the floor. And release, facing forward. Now we're going to work on little half sun salutations. We're going to inhale, lift our hands up towards the sky. Exhale the hands down to the ground. Inhale, halfway lift. Lengthening the crown. Exhale, bringing the hands back down. Inhale, lift the hands up to the sky. Exhale, hands down to the ground, onto your feet. Inhale, halfway up. Crown of your head towards the screen. Exhale, half down. Inhale, coming all the way up to the sky. One more time. Exhale, hands down. Inhale, hands up. And exhale, hands to your heart. Now we're going to turn to the side, to the left side or right side, whichever's comfortable for you. We're going to extend our feet out to our mat, our heels on our mat, our toes pointing up. We're going to do a forward fold here. We're going to exhale, forward fold, hinge from our waist, and forward fold towards our toes. Stretching our spine and our hips here. And as we're down, we're going to take a nice deep breath. As you hear, continue to breathe. Grip your hands on your ankles and walk your hands up to your thighs. We're going to move back to the center of our mat or our chair. We're going to pull our right knee into our belly now. Take a couple ankle rolls here. Rotating the ankles to the left. Getting as much motion and movement as we can here. You can reverse in the opposite direction. Now, if possible, then keep your right knee as it is and reach your left arm out to the side. If you like a challenge, you can let go of your right hand and hold it up. Take a deep inhale in and exhale, straighten that right leg out and hold it for a couple minutes, a couple breaths. If you need to, go ahead and grab the back of the right thigh and release, set the foot down. Now we'll switch sides. Left foot, bring that left knee up. Doing a couple ankle rolls here. Bringing some stillness to the foot. You're going to extend your right arm to the side. Really feel your abdominals here. You're contracting and engaging, and hold that knee here and open up the left arm. And embrace the challenge here and breathe. If you need to, go ahead and grab hold underneath the left thigh and then push that foot out. Getting a full body strength here, and hold on to the back of the hamstring. And then release back down to the ground. Good. Just taking note of how you feel, reflecting here. Now we're going to open up our legs as wide as they can go. This is called goddess pose in yoga. Our hips are open, knees are open, toes are open towards that way. As we inhale, we're going to circle the arms up, big breath in. Exhale, hands lower, down to the heart. Squeeze press the feet down. This should be activating pose. Just feel your thighs activated, your shins activated. You continue to go in these rounds of motion with your arms. Exhaling when you come down. Maybe our hands to the top of our thigh. Then drop your right shoulder down at the same time. Use that right hand to push that knee open or wider, just a little bit. It's a nice stretch here in the inner groin. There's also a twist in the upper body. Then the opposite side, left shoulder down. And then back to center. Bring your legs back in. So now we're going to do warrior two on our chair. Believe it or not, it can be done. So we're going to rotate our right leg. And our left leg steps back in our chair. You can see me here. So the left foot is flat to the mat. The right toes is point directly forward. From here, we're going to lift our arms up. This is called warrior two. Palms facing down. Now we want everything energized and activated. So really build your strength here by pressing the feet into the mat. And if like a challenge, you can actually lift your hips off the chair. But if not, just stay right here on your chair. But just push your feet into the mat to activate your muscles. Take 3 breaths where you are and lengthen out even more. Last breath. And relax. Switching sides. Step on the left foot, then the right foot. Warrior two on the opposite side. And breathe here, 3 breaths. And relax. Bring your hands back down to your side. Now bring your feet back to the center. Bring your right ankle to the top of your left knee. This pose is good for sciatica. It's also good for the hips. What you're going to do is if you can leave yourself right here, this is fine. If you'd like to go a little bit further, you can hinge from your waist and bring your body forward. While you're in this position, take a couple breaths. You're able to do this in your seat at home, at your office, at your desk, in your room.
Breath with that close.
Okay. And then right knee back down. Bring your left foot on top of your right knee. If you like, you can leave yourself right here, getting a nice stretch in your left hip. If you like a deeper stretch, you can hinge from your waist and bring your body down. So now we're winding down now. Slowing things down a bit. I'm going to inhale, back up. Go ahead and uncross your legs. Sit back into your chair. Bring your hands to your thighs. You can either close your eyes. Begin to slow down your breathing. Taking a nice deep breath in through your nose. And out through your mouth when you sigh. When you sigh, this is good for the parasympathetic nervous system. It slows down the relaxation pose. This is called Shavasana. Taking another deep breath in through your nose. And then out through your mouth. And that's the end of our session today. I hope you guys enjoyed that. If you have any questions, feel free to reach out to me or Ms. Adiola. My name is Ifia once again, and I'll send this over back to the team. Thank you.
Thank you so much. Yeah, thank you. Thank you. That was really, really relaxing. Yes. Yes, I just learned a few more moves. Thank you. I'll be doing that every morning. Yes. So it's very helpful that we do this sometimes upon awakening and also at night. It helps you relax. It helps, sometimes some of us cannot sleep. We can't just hit the bed and sleep. So some of the stretches can help you unwind. If you don't want to sip some wine or watch some movie or read, you can do the stretches and it helps you calm down and helps your blood circulate better so you can sleep better. So it's really, really helpful to do this either at night or in the morning upon awakening or AM and PM. Thank you again, Ifia. I really appreciate that. So next, we're going to welcome back Dr. Akindana for the second session. Welcome. Over to you, Emma.
Well, that was awesome. Thank you very much, Ifia. I really enjoyed that, especially the stretches. Like she said, for the sciatica, when you if you're able to get your leg over your knee and you just lean forward, it really helps with that back stretch right over our buttocks area, and really helps you to relax very much. So now we're going to continue to the next slide. And here is where we begin to tie everything in together. We talked a little bit earlier about diabetes, what that means, what's going on in our body, what are some of the things that we need to do to help ourselves stay healthier. Unfortunately, there's also the issue of breast cancer. I want to again give a shout out to Mrs. Nwabuku for her organization, just bringing this knowledge and awareness to our community and beginning to just tie so many of these things together so we can have a better understanding of what's going on in our body. I salute every woman on this forum, and my little plug for Breast Awareness Month, please, please, please get your mammogram. Oh, make sure you get your annual mammogram. It's very, very important, and do self-checks. And I'm sure when Miss Ify comes on later, she could dive in a little bit more than I can on this matter. So is there any correlation at all between diabetes and breast cancer? There's a lot of research going on in this area, and especially with people who have type 2 diabetes, they found that there is a definite correlation there, especially for women once they are over the age of 50 and they're in the post-menopausal years, increases the risk of breast cancer and also increases the risk of diabetes. So many of the risk factors are overlapping with these two conditions. Being overweight also increases the risk of both, and lack of regular physical activity increases the risk of both. Today, we've given you a taste of 2 out of 3 things that we should be doing on a regular basis for our body, which is cardiovascular dynamic exercises, such as dancing, swimming, walking, running, riding a bike, stationary or otherwise. We've also had some session on yoga, which helps with the stretching. And the other part is also muscle strength. So strengthening your muscles, even if you don't have weights at home, you could hold a kind of, whatever foods you have in the house, or even just a bottle of water on both arms when you're working, and it helps you to get some weight in strengthening to your muscles. Next slide, please. So, impact of having diabetes on people who are diagnosed with breast cancer. The good news is that even if you see a lump on your breast, 9 out of 10 of these lumps are considered non-cancerous. However, the key here, especially for people who do have diabetes, is early detection. Because once it is late in detecting the cancer, and if the person has diabetes, the choices of treatment becomes very minimized. And so there's a higher risk of mortality. So, and when we say mortality, we're talking about death, So early detection saves lives. Controlling your diabetes also saves lives. So early detection is important to reduce your risk of mortality. And unfortunately, they've found that about 20 to 27% of women which I talked about. So this is just the exact number I'm quoting here, of women diagnosed with diabetes are at higher risk of breast cancer. So self-advocating for yourself is important. If you feel a lump, sometimes even you could be of a younger age. I have a colleague of mine, she was 34 years old when she was diagnosed with breast cancer. But she has a, high family history of cancer. So even you might be younger, you need to advocate for yourself, or if you feel something, and they say, no, you don't need to do this test. Yes, you do need to do a mammogram and advocate for yourself. What are some of the risks? Why is that risk much higher? High glucose levels just makes it more difficult, even if a patient with breast cancer is going through therapy, for their body to respond to that treatment. High insulin levels, because when you have high insulin levels in your body, it does not allow your body to find what we call an equilibrium. Equilibrium is kind of a balance in the body. So, and when you have that high insulin, it makes you hungry, you want to eat, and then the more you eat, then the more your pancreas puts out more insulin, and things just go awry from there. And also, because there's tendency we have other hormones in our body that we call inflammation hormones, like cortisol. So getting upset, again, that breathing exercise, counting from 1 to 10, breathing in, breathing out. If you are anxious, angry, have anxiety, all of those things, we have what we call the fight or flight. Is a phenomenon you cannot stop. And either way, it makes your heart race faster. It makes your body release some hormones that says, okay, you're ready to do something. So and all this causes inflammation in our body. So unless you are able to say, okay, let me decompress, let me breathe, don't let me get upset right now. And I'm even learning, don't sweat the small stuff. A lot of things that we get upset about are really not as important for us to get upset about. So just controlling that stress level and anxiety would also help you to control some of those hormones as well. Next slide, please. That we should be on 13, I think. Oh, okay, keep on moving. I'm sorry, I guess I'm ahead of myself. Thank you very much. Okay, so again, here is more to the risk. And I found it interesting as I was doing research on this topic that Susan Komen has a whole article that is dedicated to this subject matter of diabetes and breast cancer. So I was really very excited because it kind of broke it down into things we can change and things we cannot change. So what do we have control over? Things we cannot change. We cannot change getting older. And we know that the older we get, the higher it is the risk of having diabetes, and the higher it is the risk of having breast cancer. Once one is after the age of 40, the risk is higher for breast cancer. And even more so, women that are over the age of 70 are at higher risk of developing cancer. That doesn't mean you're gonna have cancer, and that doesn't mean we should say, oh, we wanna die young because I don't wanna have cancer. So that's not our portion, that's not what we're saying, but we're talking here about the risk factors and what we can control and what we cannot control. Gender. We know that women are more likely to have breast cancer than men. So there's really nothing we could do about our gender. Family history, both for diabetes and breast cancer, yes, there could be family history, which increases our risk. And so when we talk about people developing these diseases, there's no automatic, oh, you're gonna get it. We're talking about the likelihood of getting it. And there are things we could do to make sure that the risk is to our favor, not getting these problems rather than getting it. And then there's the issue of race. And what I found quite interesting is that even though whites have more incidence of breast cancer, people of color, especially Black people, have higher mortality. And like I said earlier, mortality is death, the finality. So, and again, this is not my area of expertise. Miss, if you could share a little bit more light on that when she gives her testimony. But again, early treatment is important, not ignoring what's going on. Early diagnosis is important, and getting that treatment, staying on it. And I'll come back to that word advocacy, self-advocating for yourself. Yes, you may hear the word no, or they don't believe you, or whatever it is, you need to keep knocking on the door because this is our life that is at stake. Next slide, please. So here we are, things that we can change, and you see that they're far more than the things you cannot change. And so many of these things are what we've talked about earlier. And it is just, it applies both for diabetes and breast cancer, which is controlling our blood pressure, making sure it's at goal. High blood pressure is a chronic disease. A chronic disease means that there is no cure. All right. However, if you have high blood pressure, for example, and you're exercising regularly, you lose some weight, there is a likelihood that you may get on less medication or no medication. But the likelihood of that is much slimmer than you not being on anything at all. And especially if you have diabetes, the doctor might even put you on a blood pressure medicine because it protects the kidneys. So you may not have high blood pressure, but you say, why am I still taking blood pressure medicine? I don't have high blood pressure problem. Then it's most likely because it's a kidney protector, and that's why they have you on it, because we don't want too much strain on the kidneys. Lack of physical activity is something else that we can change. You need to have a plan. Even if you can't go out, we're going to be moving into winter months. I always tell people when you're watching your favorite show, that 1 hour that you're watching, just get up and move around. Walk in place, even walk sitting down, you know, anything that could increase your heart rate is going to help you lower your blood pressure. It's going to help you lower your blood sugar. It's going to help you sleep better. Sleep is very, very important to regulating those inflammations and excessive insulin levels. So it's important that we get enough sleep. Being overweight is also something that we can change. So baby steps, I already told us, just about 10% of where you are right now is a good goal to have. So you're not 200 pounds and you say, I want to lose 50 pounds. After 2 weeks and the scale didn't move, you're going to be discouraged. So you want to make sure that you set realistic goals. Maybe you just say, oh, I want to lose 10 pounds in the next, 2 months or something like that, and work towards your goal. Have a plan of how you are going to accomplish that goal, eating less, moving more, and things like that. Eating on healthy foods and diet. The rat race in this country, we tend to stop and take carry-outs, or we eat too much foods. We eat a lot of fried foods, greasy foods, high starchy foods. So we need to eat more vegetables. And we'll go a little bit more into food in a minute. I want to put a little bit more attention on that. And smoking again. If you smoke or know someone that smokes, even secondhand smoking, you may not smoke, but someone in your home may be a smoker, or they're smoking in the car where you are. People have developed cancer from secondhand smoking, being exposed to that smoke. So you want to avoid that. Alcohol, definitely in moderation, is very important. No more than 1 serving for women and 2 for men. Next slide, please. So we've talked about all these things, and believe it or not, if I tell you, it's all about what we put in our body. I spoke to a personal trainer not too long ago. I said, I want to tighten up, I want to lose weight. He says, well, ma'am, I need to tell you, 90% of losing weight is what you eat. That was a little disappointing. I'm like, I'm already eating healthy. So, well, you can look and see. And we always think that we're eating healthy, but if we're really honest, we just kind of eat what is expedient most of the time. But there needs to be a little bit more thought into preparing our meals. I enjoy more and more fixing my own meals rather than buying food out. And the other day, my husband says, oh, you don't even buy food at work. I said, number one, I don't have $7 to give them. And number two, the food don't taste good. And number three, I need to know what I'm eating. So I prepare my food the night before and pack it so I know what I'm eating. So what can I eat? That's always the $1 million question people want to know. Next slide, please. So and this correlates for both people with diabetes and or has breast cancer. So eating more plant-based foods is very, very important. So it's not all the time we have to eat a lot of animal products, because animal products have more fat in it. So we want to eat more legumes, beans. Try something new. If you go to the Spanish store, they usually have a whole aisle of different kinds of beans. And those are good because they're actually very high in fiber. So you want to make sure that you're eating a lot of fiber, okay? You want your plate to be a rainbow color plate. So you see my little rainbow color of different foods. You don't want to just eat one thing. Oh, I only like broccoli. Yeah, you could like broccoli. You could cauliflower. You could saute your peppers, green cabbage, purple cabbage, red tomatoes. You can have fruits, but you want to eat less fruits, not so much less fruits, but fruits that are not high in natural sugar. Fruits have fructose. And rather than us eating berries, we all want to have the watermelon and the pineapples and mangoes, which I'm not saying never have those things, but they just naturally also have high sugars in them. So it's better you substitute for blueberries and raspberries, and you could have kiwi, you could have tangerine, orange, clementine. You see the colors are endless. You could have squash. And we may say, oh, I'm not familiar with these vegetables. You don't have to cook them the American way. You could cook them with your regular seasoning that you use to prepare your soups and your different dishes, as long as you just including different kinds of vegetables in your diet. Limit high animal fat foods, like I said, especially those organ meats, the kidneys and liver and cow foot and all those kind of red meats and things like that. For people who are living with cancer or undergoing treatment, they may not be able to tolerate big meals at a time. So eat small, frequent meals. It's important to check blood sugars more frequently because with eating frequent meals can keep the blood sugar high all the time. However, another way around that is increasing the vegetables. Vegetables does not have a lot of carbs in it. So those are not going to raise your blood sugar as high as if you're eating carbohydrate foods. And I'll just give us some examples. Carbohydrate foods are your corn, rice, pasta, all our fufus, yam, potatoes, plantain. Milk is also a starch, carbohydrate, and yogurt is a carbohydrate. So if you could substitute your milk for almond milk, that's better if you're able to tolerate that. Or you could get 1% milk. That's also better because it has less fat in it. And there is also supplemental drinks. Sometimes patients undergoing treatment may not have a good appetite to eat, but you still need nourishment in your body in order for your body to heal. And there's a supplemental drink called Glucerna. Is made specifically for people living with diabetes. So it doesn't have a high sugar content, but it has enough protein and still has the nutrients that the body needs to stay healthy. So I'm hoping that people are writing down their questions. I've had a mouthful going, and we'll do some Q&As at the end. But before we do that, this is Breast Cancer Awareness Month. And next slide, please. We have here my auntie, even though, yes, this is a business call, is also a family education. And so my auntie, in the name of Mrs. Ifi Iwabuku, I call her my queen. And she's been in this space of looking out for people with cancer. And she made it her mission just because of her best friend died from cancer. Her mother had cancer. And much later on, she herself developed cancer. And I know she doesn't mind for me to share that she also has diabetes. And so this is why this was very paramount that we bring this information to you and that she shares her own testimony on her journey towards wellness from, as a breast cancer survivor. So over to you, Auntie.
Thank you so much, Dr. Akindena. Just 1 second, Mrs. Nwabuku. Thank you again, Dr. Akindena, for that very informative session. So yes, Mrs. Ifi Nwabuku is here to give her testimony as a survivor and of course, as a patient living with diabetes. But I'm going to do a little intro on her. Just like Dr. Akindena had just told us, Mrs. Ifi Nwabuku actually is the brain behind today's event. She is the CEO of the African Women's Cancer Awareness, the president, of course, and founder of this AWCAA. She obtained a bachelor's degree in nursing from Howard University in Washington, D.C., and a degree in hospital administration at Strayer University. Mrs. Nwabuku founded the AWCAA in 2004 in response to the lack of culturally competent services for African-born women. Now we have to pay attention to that. Our focus population is African-born women and the high rate of breast cancer mortality in this group. Under her leadership, this organization has trained lay health workers and professionals alike and successfully conducted outreach and navigation services. She remains active in the community, mentoring youth and volunteering in civic and health-based organizations. She is a 2012 Robert Wood Johnson Community Health Leader, a commissioner on the District of Columbia Mayor's Commission on African Affairs, a member of the Maryland Nurses Association, Nigerian Nurses Association, and she's also very active in African community and cultural organizations. Ladies and gentlemen, let us welcome our queen, Mrs. Ifi Nwabuku.
Okay, good afternoon, everyone.
Good afternoon.
Right. I didn't realize I added another title, but I like the Queen title, so thank you all. But anyway, I'm really happy to be a part of this educational conference this afternoon. We always like to hear from Dr. Adiola Akindana, because she really knows how to break it down so that you can connect with what you're hearing. And so for that, I say thank you, Dr. Akindana. And thank you also to our moderator. You've been doing a good job. And the least that I need to thank is Miss Ifia Ranger for showing us how to do yoga and the effect it has on us. I know that I always think yoga is not for an African, but of course, looking and watching her today, I learned a few things that I can use. So my topic or where I come in is very simple, and that's because October is Breast Cancer Awareness Month. And when it comes to breast cancer, I take it very personal. I take it very seriously. So a few housekeeping things I can tell you for this particular month. If you're a woman and you're watching this program, or you were not able to be on this program, make sure if you're over the age of 40 that you do your yearly mammogram. However, as an African descent, we get our breast cancer at a much earlier age than the 40. I said 40 because in the US, the guidelines start from 40. So if you have a family history, please don't wait till you're 40. Make sure you're checking with your primary care physician and that they're doing the necessary checkup on you. Also, if you're not even up to 40 and you notice some abnormalities to the shape, size, or color of your breast, please go see your primary care physician so that action can be taken early. And having said that, in this month of October, the key thing is to know that early detection is the key. Early detection saves lives. And so the earlier your cancer is detected, you have 95 and sometimes up to 100% of survival. And that's where I come into today's discussion. We talk about all the things that Dr. Adiola have taught us today. And there's no rule anywhere that if you're diabetic, you cannot have breast cancer. I wish there was. However, yours truly, as I'm speaking, I'm a breast cancer survivor. Thank God, at this point, I'll call myself a survivor. I was diagnosed on November 9th of 2016. I've been through all my treatment. It's not a funny place to be in. And for that reason, I do not want any other woman to go through this journey. So my own breast cancer was caught very early at stage 0. My breast surgeon said of all the stages of cancer, she would rather deal with patients who present at stage 0. because that has a guaranteed position that you have 95 to 100% chances of survival. However, what is not being told in that story is that we have 95 to 100% chances of survival. There could be other things that go wrong during that treatment journey and during your recovery. So my own journey, it was caught early because I have a family history of breast cancer in my mother's side. I opted to have a double mastectomy. Of course, the first time I had it, it was successful, but exactly 2 weeks after the mastectomy, one of the breasts got infected. And so now I'm dealing with infection. So the breast surgeon went back in, removed, what I had in there, and things kind of went well until last year, 2019. Once again, I had a second infection. And this time around, it almost cost me my life. So I'm really happy to be here to testify, to let anybody who is listening to say that whatever disease that unfortunately we have, we should not let that define who you are. We need to take control of our lives. We need to make sure that we advocate for ourselves, like Dr. Akindana was saying. But most of all is we need to make sure that whatever we're going through does not define who we are. And so for that reason, I'm speaking up today to say that as a breast cancer survivor, that I also have diabetes. So that's double whammy. How do you deal with that? These are two chronic diseases that if you are not careful, if you are not following all the things we had Dr. Akindana talk about, then you're setting yourself up for more serious health issues. And so what I was jotting notes, this is gonna be more a conversational thing between myself and Dr. Akindana. But what I jotting down some notes while she was talking. As a breast cancer survivor, one of the things that I saw that tied in that I'm also a diabetic was wound healing. If you heard me, I said that I had infection twice. And having this infection twice was no joke. The last one almost cost me my life. And so I had to go through wound care for the wound to heal on my left breast. I had the surgery September 4th, 2019. And believe me, that wound did not heal until April 1st of 2020. So you can imagine me managing a breast wound for over 7 months or 8 months. Of course, I was under the care of a skin specialist and a wound doctor specialist. I would go every 2 weeks. And I had to do my own wound dressing. Thank God I had the background to do my own dressing. But before then, I had nurses who came to the house to do the wound dressing. So wound healing is one of the connecting factors of being a diabetic and also going through breast cancer. The wound does not heal as fast as it would have on somebody who is not diabetic. So that was not fun. And the other area that Dr. Akindana spoke about is what we put in our body, our diet. So I learned as a breast cancer patient that I have to change my eating habits, that I have to go more on plant-based diet. But we know that as Africans, we do a lot of the meat, the carbohydrates. I always said that's not bad. It didn't kill us. Our mothers and fathers raised us with that. But when you know better, you do better. So what part of what I have to say today is that if you're listening to me, and if you have heard Dr. Akindana speak, we need to modify our diet so that it does not cause too much harm to our body. So that's another thing that is a link between being a diabetic and being a cancer patient. We have to make sure we're eating right. And the next thing is physical activity. Some years ago, this particular organization started a program that we called the FITS program. And what FITS means is F-I-T-S. F is friends, I for in, and T is truth. What we meant by that is friends in truth will always look out for each other as friends. And what do I mean by that? It meant that we can form groups to do exercise. And exercise doesn't have to be the hectic one that you have to go to maybe an exercise joint to do. Physical activity could be teaming up with your neighbor, your friend, your granddaughter, your significant other to take a walk. That definitely will help you. This day and age, we learn that our music is so moving. During this session, we listened to Davido with one of his music, and you saw all the women moving. So we can put our own music. It doesn't matter which part of Africa you're from. Our music is very rich. Put the music on and dance to it. That will help your heart rate. Now, the other thing that we do not talk much about is family health history. In 2012, the Robert Wood Johnson Foundation gave our organization some good money to do research as to why Africans do not pass down family health history. What do I mean by that? Dr. Adiola have told you that she is diabetic and has been diabetic for the past 21 years. I have been diabetic for the past, I was diagnosed in 2011, so that's for the past 9 years. But I must honestly tell you, with my education and everything, the only way my children knew that I'm diabetic is once in a while they catch me doing my, my blood sugar, and especially in the mornings. I think as Africans, we have to change our conversation with the family, because the earlier you let your children know that diabetes runs in this family, hopefully the better for them, because that will help them to change their eating habits, their physical activity, and also to learn what are the basic signs and symptoms so that they can know when things are not going well with them. So I'm advocating today that as Africans, we have to learn to talk to our children about whatever diseases that is common in the family. Myself being a breast cancer survivor, I have 2 daughters, and I know that I have been, they are very involved in the organization, so they are very aware that one of my daughters is not up to 40, but she knows to do her mammogram every year. And that's because it runs in my family. So it was nice to try to tie diabetes to breast cancer, because these are 2 chronic diseases that is prevalent in our African community. And I'm really happy to know that a lot of people tuned in today. We're hoping you learned something. For information basis, the African Women's Cancer Awareness Association, we're having a breast cancer screening on October 20th. So you can call our office to get more information. This is COVID time, so you cannot just walk in, you have to pre-register. There's gonna be a mammo van that is coming to our facility on October 20th. As an African woman, I will always scream, take advantage, do your yearly mammogram. It will save your life. We don't want you waiting till your breast cancer is stage 3 or stage 4. Because with breast cancer, you have the stage 0, you have stage 1, you have stage 2, you have stage 3, then you have stage 4. Stage 4 is the stage you don't want to be in. We don't want you finding your breast cancer at stage 4. So, since this topic is mainly about diabetes, I would like to get Dr. Adeola back. But before then, I also want to stress on the fact that you have to be your own best advocate. When Dr. Adeola told us that our A1C is the report card, if you're diabetic, learn to go to your doctor so that at least you can keep to the timetable of doing your A1C every 3 months. So I would like to tell you what happened to me. I do medical missions. So last November, before I went on the medical mission, I went to see my doctor. My A1C, he asked that I do my lab work. My A1C then was 6.9. So Dr. Adeola, I hope you're listening.
Yes, ma'am.
That means I did very well.
Yes.
However, since the beginning of 2020. Yours truly, because of COVID and everything going around, I never went back to my doctor again until the doctor's office called me to say they need to see me because I haven't come in to see them since the beginning of the year. So I went in 2 weeks ago. He told me, don't wait this long. But anyway, he gave me a referral or prescription to go do my blood work. I went. Now my blood A1C is 7.1. Much as it's not that bad, but I'm sure if I had kept to the every 3 month schedule, I would know before it start climbing back to 7. So all I'm saying is, please try and be your own best advocate. The doctor don't have to be calling you, come back and see me. If you have a schedule, keep to it. It's for your own good. It's for you to be able to maintain a healthy A1C level and also to maintain your healthy self and be your best self. So, Dr. Akindana, I'd like to bring you back and see how we can tie these two discussions together and then give room for questions and answers.
Yes. Can everyone hear me, I hope?
Yeah.
Well, thank you, our queen. You inspire me a lot. And I also have to just say thank you once again for giving me this platform to talk to our community. So, you know, it's okay to go to work every day and do what you do. But when you can also give back to your community, it's even more rewarding. And really just thank you for sharing your personal experience, the good, the bad, and the ugly. And as people here are listening, you can see that both Auntie and myself have no shame about sharing our story. There should be no stigma to what is going on. If you stay silent, you stay silent to your own peril. You deprive yourself of a good life. Sometimes we also deprive our family, because I tell my patients, if you die, you're lucky, because then you don't really have to worry about it. And after a while, your family member, they kind of move on. But unfortunately, people don't die, especially when it comes to complications of diabetes. They end up with a stroke, and then they are bedbound, or they're dependent on their family. They're no more contributor to society. They become a burden, or you have to go to dialysis 3 times a week for the rest of your life. That wipes you out each time, and multiple hospital visits. So it just gets ugly from there. So that's why we share our story, to say, do not be silent about your story. There is no shame, there is no stigma.
Yeah.
I'm here. If anybody needs to reach out to me, you can reach out to Mrs. Nwabuku, and she knows how to get to me if you have any questions or anything like that you want to talk about. And moving forward, we will be having on a monthly basis, I think at least for the next few months, different topics. If you have anything in mind that is of interest to you, reach out to Mrs. Nwabuku and let her know, and we will serve to bring more knowledge and shed more light on those topics. Of all the things that you really said, one of the things I want to hone in on the most is the complications that you experienced after your surgery. And that is the issue of wound healing. When you have, so it's almost like a washing machine that you just can't seem to get out of. It just keeps spinning and spinning and spinning. Once your immune system is compromised, of course, healing becomes difficult. When you have a lot of stress on your body, then your blood sugar is high, your hormones are out of whack. If your blood glucose is also not in good control, then you have more difficulty healing. You run the risk of developing infection and developing sepsis. And when we talk about sepsis, that's when the infection really goes into the blood. So now, rather than being locally at the area of the injury, it goes everywhere in your body because it's in the blood. And I mean, the death rate at that point is very, very, very high. So first and foremost is controlling that blood glucose, controlling stress, sleeping well, stop smoking, keep your drinking to a minimum, exercise regularly, lose weight if you're overweight, and if you got to your desired weight, then maintain that weight. Have a regular routine, and don't be lazy about it. Have someone who can hold you accountable. So I like the FIT program. So you could create your own FIT program with your friends in your neighborhood, and maybe I could work with Auntie to help develop some guidelines for what you need to do. Before you start any exercise, make sure that you talk with your provider, your doctor, and so that you can start in a healthy way. There is no point you go for a walk and end up with a heart attack on your way back home, then that's a bigger trouble. So always get permission of what you could do based on your condition. And I think that's really the main recap here. And be kind to yourself, be good to yourself, be selfish. There's nothing wrong about having your me time to decompress and not allowing anybody else coming into that space. Learning to say no is important. There's nothing wrong. And one of my mentors, when I say, I'm sorry, she said, please do not say I'm sorry. When you say no, you say, unfortunately, I cannot do that for you right now. Maybe tomorrow I could, but not today. So because that might be your rest time for your body to kind of recuperate. And another thing that I did not mention is drinking enough water. For me personally, I know some people may not want to do this. You can have a cutoff time if you're one of those that run to the bathroom all night. But making sure in the evening you drink plenty of water. Along the day you drink water. Have a bottle. I have a bottle of water by my bedside every night when I go to bed. And first thing when my foot hit the ground, I open that bottle and I gulp down that whole bottle of water. So drinking water keeps you hydrated, keeps the blood flowing. You don't want your blood feeling thick like syrup. Ask your doctor if you need to be on baby aspirin as well. That is essential. We're living in COVID times with all this political whatever that is going on. Make sure you keep safe. If you have diabetes, that's the people with the highest risk that are dying with COVID, or even any comorbidities for that matter. People with cancer obviously have very weak immune system. They are also at risk of falling to the demise of COVID. So keep yourself safe, keep yourself safe, keep yourself safe. So I'm gonna leave the last 10 minutes for us. If we have any questions, you can, I don't know how the moderator wants to handle that, if she has something in queue that she wants to read. Otherwise, you can unmute yourself and she could control that, and we're here to answer your questions. And again, thank you for taking time out of your busy schedule to join us this morning.
Thank you so much, Dr. Akindana. And thank you, Mrs. Nwabuku, for sharing your experience. That was really strong for you to come out and just talk about your experience, especially in times like this. I know there's stigma that's, that are associated with, being a breast cancer survivor or even living with some chronic ailments. So I really, really do appreciate your courage, Dr. Akindana, Mrs. Nwabuku. Thank you for coming out to tell us that, yes, this is real. And because of where we come from, we have actually a higher tendency to be affected with things like this. There are a lot more. We have cardiovascular, diabetes, and breast cancer. That will be one of our topics coming up. Like Dr. Akindana had just told us, this is a monthly series. We've had a couple. Some of you, I see some names that were here with us last month. We had a mental health awareness, living in these times with COVID. And then today we're having breast cancer and diabetes together. Next month, hopefully, we're going to talk on cardiovascular diseases among African Americans, because our focus population is African Americans. Specifically Africans. With that being said, we have a few more minutes before the end of this session, and I don't see any questions in the chat box, but please feel free if you have any questions. The presenter is here, Mrs. Nwabuko is also here, and we can take your questions. You can type it up or just say it whichever way. I don't see any questions. I don't see any questions. So in the absence of questions, yes, ma'am. Mrs. Nwabuko, were you saying something?
No, I see a question from military.
Okay. Military, yes. Miss Millie just sent something. She said, "Hi, Esther. My question to Dr. Akindana. I hear metformin has been recalled. Can you please tell us what's going on?" Okay. Dr. Akindana.
She needs to unmute herself.
So interestingly enough, I got an article regarding this issue yesterday. Now metformin is one of those medications that are generic. So if you are on metformin, what I would say is you need to have that conversation with your doctor. Do not stop your medication until you talk to the doctor, because I believe this is regarding a particular company rather than the whole class of drug. But if you're on that medication, what I would say is make sure to call your doctor on Monday and have that conversation that this is what I heard. Do I need to change my medication? Is there any concerns? And go from there.
Thank you for that response, Dr. Akindana. Yeah, I think it's best to follow up with our providers because this is new. We was just recently released, and there are options, there are alternatives for metformin. So if indeed the brand you take is metformin, you could get an alternative from your physician. I think the physicians are the best people to address this concern. I see Dr. Gabriel. Thank you, Dr. Gabriel, for joining us from Pennsylvania. He has a question. Yeah, you can go.
Hi, this is actually Joanna Boite. It's just in my husband's name. Sorry.
Okay.
Welcome.
Thank you for joining us.
I just want to thank God for Mrs. Nwabuko and what I've heard today, for her to just empty herself out like that for the benefit of all of us is so profound that we learn from this. We come from a community where we are so secretive about things. Even, I mean, we just believe things are from some source. Sometimes we don't want to acknowledge that it's something that we have to deal with. And we think we're going to pray away everything. So I'm so grateful that she's bringing this to the open, that our community will learn from it. I myself, I'm a breast cancer survivor, 22 years, and God knows I tell whoever wants to hear, it is real. It's nothing to be ashamed of, and it's not something that you did to bring it onto yourself. If it happens, we just have to, share it so others will be aware. Mrs. Nwabuko, I applaud you, and Dr. Akindana, great job about diabetes. It's ravaging our people. It's just one of those chronic diseases that is out there. Even back home, people are dying so much from diabetes. It's unbelievable. And Ms. Peters, you've done such a good job. I mean, you're such a wonderful moderator. Thank you all for this information. It's really wonderful. And our lady who did the yoga, I didn't know I could do. I had all kind of thought about yoga before. But thank you so much. I've learned a whole lot. God bless you.
Bless
Thank
you.
you.
Thank you. If I could just say something before we take the next question. So I am so glad because I usually go for yoga as well, and we all have this preconception of what yoga is. And Ms. Ifia Ranger is trained and a teacher of yoga, and as you see, she could bring it down to the level we understand and is beneficial. She's a yoga instructor, and we could work with her if we're interested. Where anyway, everybody can do it in the comfort of their home. If we want to have classes ongoing, we could work something out because we need that to decompress. I'm telling you, it's really, really very important that our body comes to a place of equilibrium. And when I say equilibrium, we're talking about balance. You know, you're not high strung and have too much anxiety. And sometimes we say, oh, I'm not anxious. But even though you may not be physically anxious, where you are showing it internally, we are carrying a lot of burden on our inside. And so we need to be able to release some of that. Thank you, Esther. Go ahead.
Thank you, Dr. Akindana. Thank you for sharing that. I have one more person. I'm not sure who this is, but you're showing up as iPhone. You have your hand up.
Yes.
You can-
Hi, everybody.
Hi.
Okay.
Okay, my question is going to be on diabetes. I'm diabetic also. You know, about insulin. When you take an insulin, what do you do to control the weight that the insulin causes? Is there any way somebody can make do, you know, without the insulin?
So that's a very, very good question. Insulin does have the risk of gaining weight, but working with a dietitian can help you manage some of that in terms of revisiting what you eat, having a consistent meal time. I call that making your body predictable to itself. You have to be consistent. You can't eat at any odd times of the day, and then your body is always fluctuating and you're adjusting your insulin, trying to catch up with the high sugars. And of course, like you said, if you end up having too much insulin in your body, the job of insulin is to carry food, the glucose, when your food is digested, from the bloodstream into the cells. So when you take that insulin, it's roaming around your body looking for food. So you want to take the right amount of insulin to match with the food that you're eating and reducing your carb intake. The other thing that you might want to discuss with your doctor, and you may want to write this down, grab a pen. There's a class of medication, and it varies which one your insurance covers, but it's like saying toilet paper. Toilet paper is toilet paper. But the class of this medication is called GLP-1. So you can have a conversation with your doctor about that. And there's another, so that's an injectable. And they have an oral medication that's also a class called SGLT2. Why do I bring these two drugs up? The side effect of these two drugs, even though it's to control your blood sugar, is actually to reduces your appetite and help you lose weight. So you don't only have to be on insulin, you can be on a combination of medication whereby your blood sugar is not going awry and you're requiring more and more insulin, which you're rightly said, causes weight gain.
I have a second part to that question.
Okay.
You know how they will say, like, we observe fasting, and they say fasting sometimes help you lose weight and help your body to regenerate. But I notice sometimes when somebody fasts, instead of your blood sugar, yes, you've not eaten, but instead of your blood sugar normalizing, it goes way high. What causes that?
Awesome question. So first and foremost, you're on insulin and you are fasting. So unless you've spoken to a professional that's guiding you through that process, that's the risk of hypoglycemia, which is low blood sugar. And that's a topic, Esther, that you could actually put down that we can really address, because we do a lot of fasting in our community and there's a lot of work that's being done around that area. But to answer your question specifically, when we eat food, we store that glucose, the sugar from the food. When we eat carbohydrates, it breaks down into sugar. And sugar is what we use for energy, so we do need it. And it's stored in your liver, just like when you put gas in your car, you have a full tank and it's there until you drive around and you use up the gas. So it's the same thing. You store that glucose in your liver. Now, if you're fasting and you don't eat anything, that means that your body doesn't have energy source. So if you eat, you are giving your body some energy. If you do not eat, now you're telling your body, because it doesn't want to go into starvation, it goes in and taps into your liver and say, please release some glucose because she has not eaten all day. I need some energy source. And you really don't have a turn on or turn off button on how much that liver is going to put out. And so that's why you find yourself, you check your blood sugar and you say, but I haven't eaten all day. Yeah, because your liver is doing its job, what it's supposed to do. It's putting out glucose, and sometimes it might be excessive.
Okay, so you say it's JLB1 and SGLT?
No. Listen, G as in girl, L as in lion, P as in Peter, 1.
Okay.
And the second one is S, G as in girl, SGL, T as in Thomas, 2, number 2.
Okay.
So if you take that to your doctor, they should know what I'm talking about. If you're on insulin, I don't know who is managing you, but I would recommend that you see an endocrinologist.
Yes, I have one.
Oh, you have one? Awesome. You should clap for her for doing that, because people fool around with their primary doctor far too long until there's problems. But let's move on to the next question. Thank you.
Okay, thank you.
Okay, thank you, Mrs. Ijoma, for asking that question. We all benefited from the response. Thank you again, Dr. Kindana. I don't see any other hands up or questions posted.
You have four. I don't know what's in your chart.
I see someone now, AO. I'm not sure who that is, but yeah, you can come up with your question. You're showing us AO. You have your hand up.
Unmute yourself.
Hello, can you hear me?
Yes.
Yes, we can.
Yeah.
Okay, good morning. And thank you very much, AWCA team and Dr. Akindana. Very good job, always. I joined in a little bit late, and also this is Benny, and also I enjoyed that yoga. I just want to say something, even though I'm not a diabetic, but I have someone who we actually manage this together. And talking about insulin, he was on insulin. And one thing I just want to share this, that I get so concerned and worried about, just injecting yourself and everything, and keep asking, can anything else be done with this? Because, when that sugar go up, there's something, I don't know if they call it decom, whatever, they monitor it. That thing keep bringing when that sugar go up. That when he used that insulin. But one thing that we find out in the last 3 months that I just want to share is that walking 6 miles a day, 3 miles in the morning, 3 miles in the evening, actually get him off that insulin, that the sugar regulates. And again, with the diet, those veggies that you show on, earlier in your stuff, basically that become the diet of the house. No red meat, a lot of nut fruits, a lot of veggies, less carb. I say that that's very helpful. And in the last 3 months, and he hasn't used that that insulin and the doctor actually, because he was monitoring every 2 weeks to see what it is, they said, wow, that's very good to be able to get yourself off of it. And if you can do this, you can get yourself off of it for life. And no insulin, just take the medication. So I don't know if, that's helpful to a community. In other words, more exercise, walking, walking, even if it's 1 mile, you don't have to do 3 miles. Not everybody has that luxury to be able to do 3 miles a day in the morning and in the evening. So, and change your diet. I don't know if that's helpful. The question is for you, Dr. Akindana.
Well, thank you so much for sharing that. That's a lot to unpack. I think you guys found the secret to wellness right there. I will first and foremost say that when you talk about diabetes treatment, so there's quite a few things that we need to talk about here. The doctor or even yourself, you could know if your treatment is working or not based on your blood glucose reading. So if you're checking your blood sugar. So you never really get more medicine than you need, because if you take too much, then you have low sugars. If you don't take enough, then you have high sugars. So the speaker, I don't know if you gave us your name, but the speaker told us that he changed his diet and he walks every day. And I'll tell you another secret here. Even if you do not have that luxury of walking 3 miles in the morning and 3 miles in the evening, if you get up and move at least 15 to 20 minutes after each meal, it increases your metabolic rate. And so it helps the muscle to absorb that glucose out of the bloodstream and into your cells. And it helps you to lower your blood sugar. Now, I will, even though he was able to get off the insulin, but I'm going to say this for the benefit of the rest of us. If you're going to start any exercise, it's important that you check your blood sugar before you get started. It needs to be at least above 110. Always make sure that you have a snack with you that you can eat, especially something that's fast acting, maybe like a glucose tablet or a banana or some hard candy or something like that, just in case your blood sugar drops when you're walking. If your pancreas is still making insulin, because diabetes is a progressive disease, if your pancreas is still making its own insulin, then yes, you can potentially get off that insulin if you're able to control your blood sugar. However, you will have some people that maybe because of the years of exposure or late diagnosis that they are unable to get off the insulin. I don't want us to leave this platform thinking that means I'm a failure. I am more concerned that your blood glucose is at target. Taking insulin is not going to kill you. Having high sugars is what's going to kill you. So, but yes, the more you lose weight, eat right, exercise regularly, the less medicines that you will need to take. So, and that's definitely a very, very positive thing where you could get off of insulin and transition to pills. So that took a lot of work on the part of that person. But definitely everything that was said is well taken. Discuss this again with your provider because you want to do it safely. Now, I would say one thing. I would say thank you to everybody that attended. We will stay on for as long as we have people who want to ask questions. The session is officially over, but we are here to answer all your questions. I'm not in a hurry to go anywhere. So if you have questions, you can stay on and we can keep going. Esther.
Yes, ma'am. Yeah, you said it all. Our session was supposed to end at 1, but we have very good questions coming up, so we're not going to dismiss anyone. If you have any questions, please ask. We have the expert in the house here to answer. And Ms. Ify, you can also close out if we don't have any questions, but let's give it some more time.
I think do you have 7 things in your chat box? I don't know what they are. Or
Yeah,
they're
those
just-
were, yeah, I was responding to a message.
Oh, okay.
But I have an observation though,
Okay.
and that is pre-COVID, if you put together an educational session, people will not show up. You will get maybe 10 to 20% attendance. But during this time of COVID, we don't have any place to go. We don't have any party to go prepare for. We're having educational sessions, which is good for us, and people stay there, they are patient. So if you tuned into this particular program today, or future program, or past program, clap for yourselves. Let's try and carry it forward post-COVID. Post-COVID, because we have a lot of experts and intellectuals in different fields. We can always put together whatever your interest is and have these experts, educators. So thank you very much for coming. If you have any questions we haven't answered, you can always call the office 301-565-0420, and we'll make sure we respond to your questions. So we look forward to seeing you in our next session. Thank you again. Have a great weekend. Thank you, Dr. Akindana. Thank you, Ms. Esther. And thank you, Ifaya Ranger. And thank you, everybody, for joining us. God bless you. Bye-bye.
Thank you, everyone.
Have a wonderful rest of your weekend.
Thank you.